Welcome to Tocilizumab Chronicles Beyond the Cytokine Storm, a podcast where we explore the science and impact of this medication. I'm your host, Dr. Shikha Agrawal, and joining me today is Prachi Virat, our microbiology strategist with a passion for microbiome and bioinformatics. Welcome to the show, Prachi. Let's dig into today's episode, synergistic approach combining corticosteroids and tocilizumab in severe COVID-19.
Feels great to reconnect, Dr. Shikha. Thanks for inviting me again.
Let's dive right in. What's the rationale behind combining corticosteroids and tocilizumab in severe COVID-19 treatment?
Great question, and it's really get to the heart of how we have defined COVID-19 care over the past few years. So both corticosteroid and tocilizumab target the hyperinflammatory phase of severe COVID-19, which is driven by overactive immune response. Corticosteroids like dexamethasone works by broadly suppressing inflammation at multiple levels of the immune cascade, while tocilizumab specifically blocks interleukin 6 receptors and IL-6 is one of the key cytokine elevated in severe COVID-19. The rationale behind using them together is that this dual mechanism might offer a synergistic effect. Corticosteroid temper the overall inflammatory response, and tocilizumab interrupts one of the most harmful pro-inflammatory pathways.
Wow, that's a great point you made there. How does this combination therapy impact patient outcomes?
Well, evidence is so far suggested it can improve outcomes in certain groups of severely ill patients. The recovery trial, one of the largest randomized control study of the UK showed that tocilizumab, when added to corticosteroid, reduced mortality rate and the need of mechanical ventilation in hospitalized COVID-19 patient with significant systemic inflammation. Similarly, meta-analyses published in the Lancet Rheumatology and JMA have supported these findings, showing a reduction in death rate and shorter hospital stays when combination is used appropriately.
Speaking of that, what are some potential benefits of this combination approach?
Besides reducing mortality, this combination can help improve oxygenation and decrease the progression to invasive mechanical ventilation. There's also some evidence suggesting it can shorten ICU stays, which is crucial for healthcare system management during COVID 19 surges. Importantly, by targeting different aspects of the immune response, it may more effectively curb the cytokine storm without completely shutting down the immune system ability to fight the virus.
Are there any considerations for healthcare providers when using this combination therapy?
Definitely, and this is where clinical judgment is key. Timing matters. Tocilizumab seems most effective when given early in the hyperinflammatory phase, typically when a patient is experiencing rapid respiratory decline, but before they require mechanical ventilation. Patient selection is also critical. Those with high CRP levels or other markers of systemic inflammation tend to benefit the most. Additionally, clinicians need to weigh the risk of immunosuppression, like secondary infection, especially in patients with purely controlled diabetes, existing infections, or other immunosuppressive conditions.
Before we wrap up, what's the current understanding of the role of combination therapy with corticosteroids and tocilizumab in severe COVID-19 management?
As of now, combination therapy of corticosteroid and tocilizumab is considered standard of care in many international guidelines, including the WHO and NIH recommendation for select hospitalized COVID-19 patients with severe or critical disease and systemic inflammation. It's not for every patient, but in those progressive rapidly with elevated inflammatory markers. This combination has consistently shown a survival benefit. That said, ongoing research is refining exactly when and in whom it's most effective and how best to balance immunosuppression risk.
Prachi, I really appreciate you taking the time to break this down so clearly for our listeners. A big thank you to all our listeners. Your support keeps us going. Follow the podcast and spread the word if you enjoyed the episode. Until next time, stay curious.